Quotations, who are having a tag sale today, tomorrow, and Saturday and Sunday. Today, Brad and I are broadcasting from our administrative offices. It happens to be Employee Appreciation Day. As a business owner, I know that I wouldn't be here today without my staff. I would like to take a moment to thank each of our employees for all they accomplish each day to support our patients. This morning, Brad and I are going to share the top 10 tips for wellness. We hope you all spend some time with us as we discuss how pharmacist is your partner for good health.
Good morning. When most people think of a pharmacist, they think of that friendly professional in a lab coat behind a tall pharmacy counter counting pills and putting them in a bottle. At the Medicine Center Pharmacy, the job of a pharmacist isn't just about filling prescriptions, it's about helping people live healthier lives. Pharmacists coordinate all of your medications from all of your doctors as a single point of coordination on your healthcare team. And best of all, they're available to talk to you anytime. There's no appointment necessary. Today, we're going to share with you our top 10 tips to help you all stay healthy and live your best life and accomplish all those things that bring you joy. We want to remind our listeners that our program is also available on our podcast. It can be downloaded from the App Store of your favorite podcast app. Just look for Health Matters with the Medicine Center Pharmacy, and you can listen to any of our programs anytime.
So, friends, I would like to start by saying thank you. We appreciate that you tune in and share this time with us. In addition, our Medicine Center Pharmacy was voted Best Pharmacy for the third consecutive year by readers of the Canton Repository. We are proud to be your pharmacy and thankful to all of those who voted for us, and thank you for your continued support. As Brad mentioned earlier, staying well is a priority, and like all priorities, it requires a plan or a strategy to be successfully fulfill the priority. This morning, we would like to share our top 10 tips for staying well. So our first tip is get vaccinated. You can turn on the news today without listening to a story about COVID vaccinations. And our number one tip is stay immunized, not just with the COVID vaccine, but all recommended vaccines. Many people missed regular routine immunizations during the pandemic. Brad, can you tell our listeners about the immunizations we currently offer and if we can get multiple vaccinations at one time?
Yes, at the Medicine Center, we've been proud to be part of the COVID vaccination effort. And currently for COVID vaccinations, we have Johnson & Johnson, Moderna, and Pfizer vaccines. So if you need your booster shot still, or you need your second dose in the series, we can still help you. But, don't overlook other vaccinations that are necessary for a healthy life. A lot of people waited longer this year to get their flu vaccine. And we actually were still giving flu vaccines last week. So we're almost out. So if you still need a flu vaccine, we'd be happy to help you. Those are probably the big ones, but don't overlook children's vaccines in particular. There's a lot of patients that missed regular appointments during the height of the pandemic, and as a result, kids are behind on their series, whether it be MMR or some different things like that. We have a lot of vaccines available every day at the Medicine Center, from pneumonia vaccines. We have Pneumovax and Prevnars. There's shingles vaccines. The main one's called Shingrix now. You can get your Tdap vaccines, MMR vaccines, hepatitis A and B. And if you're thinking about branching out, we do have some travel vaccines that we can offer by appointment. So if you have questions about which vaccines you need, just talk to one of our pharmacists. Sometimes we can get you more than one vaccine at the same time, depending on which one you're getting. So talk to us and we can work that out for you. But the good news is that any vaccine you get at the Medicine Center, we report it to the state database, so your doctor can have access to it and they'll know everything that you've gotten and you're up to date.
Okay. It might be intimidating to some listeners to get a vaccine or immunization during a pandemic. Can you address that concern and share how we are managing that concern at the Medicine Center Pharmacy?
Well, I think one thing that we've learned throughout the pandemic is that there are people that know they need to get a vaccine but don't like a shot. And frankly, I don't know anyone that likes a shot. So keep in mind that we do our best to make it as painless as possible. We try to make it easy. You're welcome to go on our website at medshoprx.com and schedule an appointment so that we can reserve a slot for you. But you can also walk in the pharmacy, and generally we like to be able to get you in and out in somewhere between 15 and 30 minutes. Many of the vaccines we give now, the guidelines recommend that you hang out for at least 15 minutes after. So you're going to want to plan at minimum a 30-minute visit block. And if all goes well, we can get you in and out in maybe 2025. But that 15-minute layover there to make sure that you don't have any adverse reactions is important for your safety. But we take the standard precautions that you're used to now in a healthcare setting. Currently, our staff is still wearing masks, but we wipe down our frequently touched surfaces, and we make sure that you can have some privacy during your vaccination appointment. So hopefully that can put you at ease, and we try to have a nice conversation and make it as comfortable as possible.
So Brad, and audience, our number 2 tip, know your numbers. Brad, can you explain what know your numbers means and what lab tests we offer at Medicine Center Pharmacy?
Yeah, for many years we've offered low-cost lab tests, and at one point we had partnered with the hospital and things changed, so we started doing those tests in-house. So we offer a number of basic tests. I've got my list here, but our most popular tests are lipid profiles and glucose. Those are tests that are simple to do in the pharmacy. Generally we have you schedule an appointment on our website, or you can call in and we can put aside an appointment for you. That process takes anywhere from 15 to 25 minutes, depending on which test you're going to have. So the pharmacist will draw your lab sample. All our tests are finger stick tests. We don't draw out of your vein in your arm. So it's a little less invasive than what you might be used to if you go to a lab for, the hospital or your doctor. For the glucose and lipid profile test, we give you results there on the spot. It takes about 10 minutes for the lab test to run in the machine. So you can have tests that same day. We do some other tests that have been popular. TSH, a thyroid indicator test, is a popular one. That test is one we have to mail out, and depending on the lab, it takes between 7 and usually 10 days to get that back. We can get you those results. Those are the most popular ones. We do for patients with diabetes that are looking to keep an eye on their numbers. We can do the hemoglobin A1C. That's something that's real easy to do. That test takes 5 minutes to run on the machine. So again, you're looking at a 15-20 minute appointment, give or take, by the time we do start to finish and discuss your results with you. One of the things we like to combine with our lab test services is that we'll give you some feedback on your numbers. We're not going to diagnose and tell you that, you have a problem that maybe you're not aware of, but we will give you our feedback on what the normal guidelines are, where your numbers should fall, and if you need to follow up with your physician. And, a lot of times we see patients that come in the pharmacy that don't have a regular physician. So we can try to help give you some guidance on where to go if you need to be followed up with.
Okay, here's the big thing. How much do these tests cost?
The lab test, from the feedback we get from the patients, it's not too bad. A lipid profile with glucose, we charge $35 currently for. An A1C, we charge $35 for. A TSH test, I believe, is $45. So none of these tests are necessarily break the bank. We have a lot of patients that don't have insurance or have really high copays that like to come to us to get these so that they can inform their doctor of what their levels are, but then they don't have to pay, several $100s at the lab to get that done. So we like to try to meet you in the middle and be as affordable as we can to provide a service that isn't readily affordable in the marketplace.
How about tip number 3, support your immune system? Pharmacists are available to give you advice about over-the-counter remedies and supplements. Brad, what supplements do you recommend?
During this entire pandemic, we've talked several times on Health Matters about things you can do to kind of give yourself an advantage. Simple things you can do before we start talking about supplements. Get enough sleep, get some rest, try to control your stress levels. There's a number of ways to do that we could talk about, from prayer to meditation to even getting some exercise to blow off some of that steam. But for supplements, I have several go-tos personally that I use. And, you can't go wrong with a basic multivitamin. The multivitamin we recommend now is our White's Premium Active Life Nutrient Capsules. There's over 22 nutrients in one capsule. It's one capsule a day. One bottle lasts you 2 months, so it goes the distance. If you're busy and you're on the go and you're eating a lot of fast food, you may not be getting the type of nutrients you could get in a diet well-balanced and, healthy vegetables and fruits and things of that nature. So don't be afraid to supplement with a basic multivitamin. There's good studies out there that shows that even patients that take a basic multivitamin can get a reduction in common colds by 25%. So, put odds in your favor by giving your body the nutrients they need. Now, if you want to go to the next level, there's some things you can do to boost your immune system, or maybe it's just to give yourself an advantage. One of the things that I've taken every day since before the pandemic started is one of these Immunity Power beta-glucan products. This gives you some benefit for basically improving your immune system response. There's studies on beta-glucan and how it can benefit things with respect to immune system quality. And, that's something that, frankly, I guarantee it money back. If you're not happy, bring it back and we can give you a refund. Another one that I like to use when I get a cold or get sick is called Empower. It's a shiitake mushroom product. And there's a lot of research on mushrooms with respect to how they may be able to enhance the immune system response and combat different things to help improve natural killer cell effectivity. So none of these things are a guarantee. None of these things are a holy grail. It's all about putting yourself at an advantage. Throughout COVID, we've talked about a number of things on Health Matters, one of which is, a simple zinc supplement every day. So whether you're a patient with diabetes or not, 150 milligrams zinc a day can benefit you based on helping improve your blood sugar utilization, but it also can help your immune system deal with the assault of the COVID-19 virus on your body. So those are just a couple things. I mean, we could go in depth further, but good multivitamin, maybe a beta-glucan product on a daily basis, and don't overlook quality sleep and stress management to help kind of put your body at ease. And we can take a break when we're ready.
Okie doke. You are our first break. You're listening to Health Matters with the Medicine Center Pharmacy.
Are you ready for a change? Transfer your prescriptions to the Medicine Center Pharmacy. Hi, this is Paul White from the Medicine Center Pharmacies. Are you looking for the personal touch from your pharmacist and pharmacy staff? Do you need home delivery or custom packaging to simplify a complex medication schedule? Look no further than the Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Bring in your prescription bottles, and we can transfer your prescriptions to the Medicine Center today, where wellness begins. Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin or Dayquil, cough drops, maybe even a humidifier or a vaporizer. You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. The Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia.
Spring has sprung at Studio Arts and Glass. The hummingbirds will return, and Studio Arts and Glass has the feeders. Wind chimes, felt birdhouses, and garden art all make great gifts. Are you going to the beach? Then you need sea glass. Sterling silver and sea glass necklaces, earrings, and bracelets. Studio Arts and Glass open Monday through Saturday, 10 to 6 on Apple Grove and 77 in North Canton. StudioArtsandGlass.com.
Hi, Paul White from the Medicine Center Pharmacy. If you haven't gotten your COVID vaccine shot yet, you've got to get to the Medicine Center Pharmacies in Canton, Louisville, Minerva, or New Philadelphia. We are waiting for you and have vaccine. Call or stop in your closest medicine center pharmacy and we'll take care of you. Getting a COVID vaccine will save you from getting very sick. So hurry and get on with protecting yourself. The Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia.
We'd like to remind our listeners our program is also available on our podcast. You can search your favorite podcast app for Health Matters with the Medicine Center Pharmacy. Listen to our program anytime.
Welcome back to Health Matters with the Medicine Center Pharmacy. We have flu vaccine, a little bit left with Moderna and Janssen COVID vaccine are available. Stop by any of our stores to get vaccinated. No appointment necessary. So, Brad, take your vitamins is important for the children in our lives as well. Can you tell our listeners about our special program for children's vitamins?
Yes, we'd be remiss if we didn't mention the kids too. So, we've had a program for a number of years that's been very popular with educators and parents. And it's basically our free kids vitamin program. That I did say free, that wasn't a typo. For children in grades kindergarten through 5th grade, we can provide a chewable vitamin on a monthly basis to your child. All you got to do is come into the Medicine Center Pharmacy and sign up with one of our staff members, and we'll get you going. But basically, again, it comes down to just simple, basic nutrition. It's not going to replace what you eat or drink on a daily basis, but it'll help be a nice supplement to help round out that child's diet. So it's a chewable vitamin. They're fruit flavored. They're kind of like the Flintstone vitamins. But don't be afraid to take advantage of that in our local communities.
Okay, so many of our patients are immune compromised. Others appreciate the opportunities that the pandemic created to allow for more social distancing. Staying away from others who may be sick is important, and we explain the easy way we can make that forward.
Well, one of the things we've all learned during the pandemic that we've kind of had some habits changed. Maybe we didn't realize it, but I think some of us are liking it a lot better. And I'll give an example that isn't pharmacy related in our instance, but we'll bring it back. So, one of the things I think is interesting is many of the food establishments went to curbside pickup when they couldn't be open or people didn't want to dine in because they were worried about being infected. Well, it's interesting now how many restaurants continue to keep curbside pickup because people have found it so convenient to pick that up on their way home from work that it's just been a normal feature that they do every day. At the Medicine Center, for decades, we've had drive-up windows before when only, fast food joints had drive-up windows. So they've always been important for parents who just came from the doctor with their sick kid and they didn't want to have to get the kid out of the car and bring them in the pharmacy to get their antibiotic or their prescription filled. So drive-up windows have always been a convenience we've had. For decades, we've also had home delivery before it really became popular during the pandemic. So that's something that we've had standard. But we've also added curbside pickup also at the pharmacies. And right now, if you download our app from the pharmacy or from our website, you can text our staff and it comes right up in our pharmacy computer. And whether you're at home in your living room and you have a question about your medication, or if you're in our parking lot asking to have your order brought out to you, you can communicate with us in a HIPAA secure way where your information will be private and protected. And we can help answer your questions or provide you service right there in the parking lot.
A lot of people during this time have kind of put off going to the doctor. So it's time to get back in order. So if you're like me, you have the best intentions when it comes to following doctor's directions. But sometimes our memory plays tricks on us and we think we took our medicine. But did we? Can you tell our listeners, Brad, how we can help with that?
One of the most common questions we get is I'm having trouble managing my medication. And, whether it's remembering to take your vitamins or to take your medication, it can be challenging when you get more than 2 or 3 medications, or when you have one medication that's once a day and the other ones are 3 times a day or 4 times a day. I mean, when do you take that stuff? So one of the features we have, which has been very popular in the last year and a half, is our Easy Dose Packs. And our Easy Dose Packs come in a box. And what we do is we can make a strip package for you where we can label all of your medications with the time and date and time of day. So if you take a medication at 8 a.m. and 8 p.m., like in this example, we'll have a packet that has those medications for you packed up and ready to go just with those medications. So maybe you're a working professional and you spend 9 to 5 at work every day. You can tear off 2 packets and you can take these with you to work, and you don't have to take your whole bottle of medication with you. You don't need to worry about filling up a pill box. Or maybe you just want to make sure that you don't miss a dose. So as these are pulled out of the package, you can pull off the next dose for this time of day. And if the package is still there, you'll know that you missed it. And then you can call us at the pharmacy and we can give you guidance on what to do if you missed a dose. So keeping track of your medication is important. And you'll find that your doctor, and your pharmacy want to support you in making it easy, because especially if you take medications for heart or diabetes, if you miss doses, you put yourself at risk for being hospitalized. And we don't want you to be hospitalized any more than you want to be hospitalized.
If you don't partake of our unit dose packaging, I think one of the things that really kind of bothers me is if you're taking meds every day, and then you've got a dosage of a medicine that you take every other day. I think that takes special attention, because quite frankly, I have a problem remembering that every other day med. So I kind of put them aside and just make sure that bottle is turned upside down after every time I take it. So bottle's okay, but you got to manage that part of your medication taking properly. So, okay, Brad, how about managing chronic conditions, whether it is high blood pressure, diabetes, cholesterol, or other conditions? Managing them to stay in line with the physician's recommendations is critical. Can you tell our listeners how we help our patients manage chronic conditions and make it as affordable as possible?
There's a couple things we do. Our business as a pharmacy and the services we provide have changed a lot over the last couple of years, just because of how we try to be more proactive. One of the things that's been a challenge for patients, in my opinion, is there's a lot more patients that see specialists. So let's say you're a patient with diabetes. You probably have your primary care physician that you see once or twice a year. You might have a doctor that you see for your cardiovascular system and your heart. You probably have a doctor you see for your diabetes. So right there, you've got 3 doctors if you have no other issues. So then you've got 3 different doctors, possibly all prescribing medications at different times when you go to different appointments throughout the year. So one of the things we've tried to do is bring all that together and try to help people manage their medications in simple appointments. So much like you make an appointment at the doctor, we are striving to have patients make an appointment at the pharmacy, so that that maybe the second Tuesday of the month is your day of the month to make sure you pick up your medications, and we're going to do our best to try to provide all your medications for the whole month at that time. Sometimes that's a challenge because you may have an inhaler or some insulin that maybe lasts longer or shorter than 30 days. But the goal is to make sure you have everything you need all at one time to minimize the risk of you being out of a dose or missing a dose. And so that's one of the things that we've done. We call our staff members health coaches. We're not trying to, preach at you what to do, but we're trying to make sure that we have the right medication in stock for you at the right time and minimize the opportunity that you're going to be out of medication. And we'll even call your doctor in advance and try to help make sure that you've got refills. Sometimes it's a challenge syncing up with you and your doctor's office, what needs and if there's changes, but we try to work through that. So I think we're at the point where we better be thinking about taking the news break.
That we do. It is the bottom of the hour. Time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy.
Spring has sprung at Studio Arts and Glass. The hummingbirds will return, and Studio Arts and Glass has the feeders. Wind chimes, felt birdhouses, and garden art all make great gifts. Are you going to the beach? Then you need sea glass. Sterling silver and sea glass necklaces, earrings, and bracelets. Studio Arts and Glass open Monday through Saturday, 10 to 6 on Apple Grove and 77 in North Canton. StudioArtsandGlass.com.
WHBC AM Canton, reliable as ever on News Talk 1480 WHBC.
From the News Talk 1480 WHBC newsroom, the CDC has updated the map showing which communities are low, medium, and high transmission for COVID-19. Green and yellow are low and medium, which indicates indoor masking is not recommended. The CDC says more than 90% of Americans live in either a green or yellow county. In Ohio, only 10 of 88 counties are still red. Former U.S. Representative John Bocheri of Poland, Ohio, is under consideration to replace Steve Dixon of the FAA at the end of the month. Bocheri served, as you may remember, a single term in Congress as the 16th District Congressman from 2009 to 2011. He now works as a Cleveland-based pilot for United Airlines. French President Emmanuel Macron believes the worst is yet to come after a 90-minute phone call with Vladimir Putin. According to the French news outlets, Macron is convinced that Putin wants control of all of Ukraine and has no intention of backing down its military aggression. The Ohio State Buckeyes rebounded in a big way by beating Michigan State last night 80-69. They have a final regular season game against Michigan tomorrow, and then it's on to the Big Ten tournament. Tonight on 1480 WHBC, it's Division IV District Final in boys high school basketball tournament action. St. Thomas takes on Lowellville from Struthers. 6:45 will be the pregame. 7 o'clock will be the tip-off. For News Talk 1480 WHBC, I'm Pam Cook.
Your severe weather station, News Talk 1480 WHBC.
Here's your AccuWeather forecast. Partly cloudy this afternoon, high 44. Very cloudy tonight, low 34. Cloudy in the morning tomorrow, partly cloudy in the afternoon, high 68. Then look for a passing shower Sunday morning. Otherwise, windy and warm with a mix of clouds and sunshine and a high of 69. Expect rainy weather late Sunday night, continuing through Monday afternoon. High Monday, 47. I'm Holly Aldrin for News Talk 1480 WHBC.
Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin or Dayquil, cough drops, maybe even a humidifier or a vaporizer. You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. The Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia. When you list your tag sale with Genuine Estate Services, you will experience professional sorting, researching, staging, pricing, and marketing of your cherished possessions. They have a large staff hosting your sale also, and they are very efficient. Call Eric at 330-206-0974 or log on to Genure, spelled Jenior, estateservices.com for more information. Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Out By store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out By store in Louisville, next to the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Brad and I are discussing our top 10 tips for wellness today. We have a lot more to cover this morning, so let's get back to the show. So, education. You've heard the expression knowledge is power. Well, it's true when it comes to maintaining your good health. When it comes to pharmacy, that means knowing what medications you take, what they look like, and what condition they are treating. So, Brad, can you talk with our listeners about the Medicine Center Pharmacy, how they can make that easier?
Well, we have a number of tools. The first tool that I can think of off the top of my head is I'm going to talk about the value of our iPhone app again, or Android app. One of the nice things about that, not only can you use it to communicate in a private, secure way to our pharmacy to ask questions, but you can also use it to see images of your medication. So on all our bottles, if you use our bottles or if you use our dose packs, we put information on the packs or the bottles that tell you what the numbers or color of the tablet or capsule should be on there. But sometimes, you get enough white tablets, it gets really hard to tell the difference. So if you have our app, you can look at all your medications in the app and you can see pictures of what your medications look like. So if you're ever concerned about which one's which, and maybe you're not able to give us a call to talk you through it, you can look on the app and see it. So that's one way. The other thing is simply, our pharmacists are happy to provide education to you on any questions that you may have. We frequently do medication reviews with patients that have medications so they understand what their medications are, why they're taking them, how to use them, what to do if you miss a dose. All those things are simple questions, but it gets a little intimidating maybe when it's 8 o'clock at night and you forgot to take your blood sugar medication and you're like, what do I do now? So all those things are important to know. We have handouts and flyers at the pharmacy that can give you information on different medications or on different subjects like vitamins and supplements. And, we're looking to have more patient seminars where we can provide education on different topics, whether it be on how hormone replacement therapy might benefit you or how to manage stress, or even simple ways to try to deal with pain that maybe you're struggling with. So there's a lot of different ways, but don't be afraid to pick up the phone and call the pharmacy when you have a problem, and we'd be happy to work through and help you find a solution.
Okay, tip number 8, know your pharmacist. Do you know your pharmacist by name? We think it's important to know our customers by name and develop a relationship with that. You feel free and call anytime and ask your pharmacist to discuss any questions or concerns you may have. So, Brad, what are the benefits of knowing your pharmacist by name?
I think one of the things that I enjoy the most about being in the pharmacy is when I see people that we've known for years that come in and rely on us for good service and good information. I think when you have the comfort to know your doctor or pharmacist, you have the ability to be a little more real and ask questions in a way that maybe you're not as reserved and feeling like you're going to be asking a foolish question or be embarrassed about the question. You got to admit there's a lot of things that happen related to your health that may not be the first thing you want to discuss with anyone. So if you have someone you can trust, like your pharmacist, that where you can ask a question that's a little bit embarrassing, it makes it a little easier to ask that question and get some feedback. So, we got a lot of people that'll walk in the pharmacy and be like, I've got this spot on my arm. What do I do about it? But that's a simple thing. But, whether it's, oh my gosh, is this poison ivy, or what do I do if I'm having some GI issues? Don't be afraid to talk to us and get to know us. We're not going to bite. The goal is to help you through your problem. And, maybe we can save you a trip to the doctor in the process.
Very good. So, make it affordable is tip number 9. We all know healthcare and prescriptions can be expensive, but you may not know that sometimes your pharmacist can help make it affordable. So, Brad, what do you suggest to our customers and patients who are struggling with the cost of their medications?
This is a daily challenge, and I think it's one of those things that has really been at the top of the news despite everything else going on in our world today. But, you get barraged. You can't turn the TV on without seeing ads for different companies that promise to save you money. I implore everyone listening or watching today to think about this. All those companies that you see on TV with famous actors or promises that sound too good to be true, they are making money off of you. So how about this? Come to us at the pharmacy and talk to us about what to do about medications that are a burden on you. The good thing about our pharmaceutical choices today is that we have a lot of solutions across similar drug classes. So while there may be a drug that costs $400 a month for you to deal with problem A, there's a pretty good chance that there is a generic medication in the same drug family that might not cost but 10 or 15 bucks a month. And while 10 or 15 may still be a burden, it's a discussion we can have with you and your provider to see if there's a way to help you meet the need. One of the things that's really frustrating to me as a pharmacist is when you see all these ads on TV for all these wonderful companies that are going to save you 80% off your medication. You know what? They're just hitting you for it somewhere else. You may not realize, but when you sign up for a particular wonderful RX card or a independent care card, to be politically correct, they are taking all your information and they're selling it to everyone. So if you're concerned about your privacy and your health care and your health information, think about that before you blatantly go and pick up a card and use it, because once you use it, all your information's everywhere. So talk to us at the pharmacy. We'd be happy to help you work through these problems and look for solutions that could be more affordable. Sometimes there's situations where we mentioned it earlier in the program, where you're seeing multiple doctors. And there's been instances where we've caught patients that get similar medications from different doctors. And in that way, we can help you eliminate a duplication in your therapy, and that automatically saves you money. And one other thing that I would be remiss if I don't mention is if you're a patient that's eligible for Medicare and you don't take advantage of doing an evaluation each year of Medicare Part D drug plans, you are lighting dollar bills on fire, okay? So if you like to start your fire in your fireplace with a $100 bill, good for you. But I promise you, if you are not evaluating and questioning your Medicare Part D provider every year, you're wasting money. Every year we talk to people that could save several $100s by switching plans, getting the same service, and having better coverage for a lower price. And people are reluctant to change because they've been with company A for years. So don't overlook the benefits you can get from Medicare. Sometimes Medicare can be frustrating because of restrictions, but I got news for you. Medicare age patients can benefit a lot from all the years they paid into Medicare on drug plans alone. You just have to know how to pick the one that meets the need for the drugs you take. So don't overlook that.
Okay. Tip number 10, enjoy life. We hope that making life easier at the pharmacy will contribute to your overall happiness and well-being. We appreciate you and wish you good health today and every day.
All right. Well, there's a couple things we can hit here before our final break here, but, our goal at the pharmacy is to make it easier. And one of the best things we can do is get feedback from you, our patients, and our public. We've really seen growth in our home delivery service over the past year and a half when people have been reluctant to venture out. Don't be afraid to take advantage of that service if you need it. All you need to do is call the pharmacy and we can schedule you for our next available time slot. One of the things we like to do is make sure we can line up all your medications so that we can get you that home delivery in a timely fashion. And with gas approaching $4 a gallon, I'm sure that you want to think about using services that companies like ours do for home delivery, but we want to make sure we make it efficient for you too, so that we value your time and we make sure we don't overtax the environment with extra, waste. Other things that we can do at the pharmacy, a lot of times we don't know if you have a need unless you mention it. Maybe it's that simple question of, are all these medications I'm taking really worth it? Does my doctor just trying to give me another medication to make money off me? I've had that question, which is kind of, I don't think your doctor doesn't write prescriptions to make you spend more money. I think, your doctor wants to have your best intentions. They want to help you be healthy, and they're trying to follow the standard of care. So don't overlook those things. We can talk about some other things after our commercial break here, but, we want to support your health. Ask questions and help us guide you. Are you looking for different lab tests other than the ones we offer? Go ahead and bring it up to us. Are you looking for maybe an education piece on a subject that you have an interest in? Hey, let us know. We can certainly work with you.
Well, I guess it's time for our final break. And you're listening to Health Matters with the Medicine Center Pharmacy.
Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Hot Buy store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Hot Buy store in Louisville, next to the Medicine Center Pharmacy.
Hi, this is Brad White from Health Matters with the Medicine Center Pharmacy.
And I'm your pharmacist, Paul White, for Health Matters with the Medicine Center Pharmacy. During our past shows, we've discussed heart disease, nutrition, diabetes, estate law, allergies, blood pressure, and several other topics with area experts to educate and help you live a healthy life. Join us this Friday at 9 a.m. for Health Matters with the Medicine Center Pharmacy, right here on News Talk 1480 WHBC, or listen to our podcast on WHBC.com, because your health matters. When you list your tag sale with Genuine Estate Services, you will experience professional sorting, researching, staging, pricing, and marketing of your cherished possessions. They have a large staff hosting your sale also, and they are very efficient. Call Eric at 330-206-0974 or log on to Genior, spelled Jenior, estateservices.com for more information.
We'd like to remind our listeners our program is also available on our podcast. You can search your favorite podcast app for Health Matters with the Medicine Center Pharmacy. Listen to our program anytime.
Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin or Dayquil, cough drops, maybe even a humidifier or a vaporizer. You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. The Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia. Hi, Paul White from the Medicine Center Pharmacy. If you haven't gotten your COVID vaccine shot yet, you've got to get to the Medicine Center Pharmacies in Canton, Louisville, Minerva, or New Philadelphia. We are waiting for you and have vaccine. Call or stop in your closest Medicine Center Pharmacy, and we'll take care of you. Getting a COVID vaccine will save you from getting very sick. So hurry and get on with protecting yourself. The Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin or Dayquil, cough drops, maybe even a humidifier or a vaporizer. You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. The Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia.
Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Thanks for joining us this morning. Let's get back to the final part of the show.
All right. Well, here we are. We've been talking today about a number of different things. We've talked about how to save money at the pharmacy. We talked about some of the services at the pharmacy. We haven't talked about how we help support patients that have diabetes and need to test their blood sugar frequently. And we thought in our final segment here, it'd be a great idea if we talked about our Easy Max meter. There's a lot of blood glucose monitors on the market today. There's even fancy ones that you can hold your cell phone up to, and it takes the reading on your phone with a little sticker that you wear on your body. But you know what? They're pretty expensive. If you're looking for an affordable way to test your blood sugar on a daily basis and not break the bank, our Easy Max meter is one that can really be an asset to you. So we've been lucky enough to work with diabetes educators at both Altman Hospital and Cleveland Clinic Mercy Hospital. And they're very pleased with this meter and recommend it to their patients. This meter is great for a number of reasons. It's got a couple different languages. So it's got English and Spanish. It's got a very nice large display. So if you have difficulty reading small numbers, you'll love this. And if you want somebody to talk to, it'll talk back to you. So it'll even verbally announce your readings for you. The great thing about this is these test strips don't cost $50 a month. They don't cost $25 a month. They don't cost $15 a month. These test strips run less than $9 a month for a box of 50. So 50 strips for less than $9, you can't beat it. And it'll help you be able to monitor your blood sugar in an affordable way and an accurate way. So you're not compromising your health by not using one of the big brand name test kits. You're just protecting your pocketbook and then helping make sure that you can be better informed for your provider. So if you have questions about the Easy Max meter, stop into any medicine center pharmacy in Canton, Louisville, Minerva, or New Philadelphia. If you're a new patient with us, we'd be happy to give you one of these at no charge. And then when you buy a box of test strips going forward, they're like $8.32. Very affordable, very easy to use. Do you have anything you want to add?
We have actually had in some of the visits from other people and shows we've done, we have actually had people come to us and say, I'm spending $100 a month for strips, and it's taking away from my food budget and from my gasoline budget and all that sort of thing. And when we started this program several years ago, it really was revolutionary because nobody else out there had a low price strip that was effective. Okay. But this is a top quality product. They're constantly making improvements. Sure, we'd all love to have a glucose monitor that you don't have to poke your skin with, and there is a sort of one out there, but this unit is, as far as we are concerned, is the most economical in the marketplace. And as Brad said, we'll give you a complete kit, new patients, and you get a lancing device, you get lancets, you get a box of strips, and of course you get the monitor. So stop in and we'll talk to you about it. Okay.
Okay.
And we also have in all of our stores, and even in the Half Off store in Louisville, we have numerous types of lotions and skin care, because a lot of people with diabetes have dry skin and other sorts of issues. Their feet get dry, and we have a bunch of products, and we have some great stuff and a wide selection for you to choose from. So those are very useful products too.
All right. I guess I think we covered our top 10 questions for health today. We've had I had a couple other things here that we could touch on before we wrap up, but it's not uncommon for patients to call the pharmacy looking for primary care physicians. A lot of physicians right now actually are operating at capacity. So if you're looking for a physician who is taking patients, don't be afraid to give us a call at the pharmacy, and we can try to help find someone close to you. We try to talk to offices frequently about this, And the good thing is that there's always new practices that are starting up in our community. We're lucky to have a lot of specialists and a lot of expertise, but sometimes it's a little difficult to find who has openings. So don't be afraid to give us a call at the pharmacy and we can help you with that. In other news, we've got some new things coming up here at the pharmacy that we're working toward. One exciting thing is that we are currently in the process of remodeling and building out a new compounding facility in our new Philadelphia store. We are going to be able to handle a number of new procedures and preparations to help patients and doctors expand their treatment properties and treatment options. The good news is that there's a lot of changes in our environment where the regulations are getting more stringent, and we're going to make that investment for the community so that we can be there for you and support you in those needs that you have that can't be commercially made. So, if you have questions about products that maybe you have trouble with, our most common question this week in the pharmacy is that a particular patient has had an allergy to different fillers in their medications. It could be lactose, it could be fructose, it could be red dye number 4. So one of the most common things we've done this week is we've helped customize medication dosages for patients that are dye-free and allergy-free. Something as simple as that, it doesn't sound like a big deal, but if you need a medication that only has red dye in it and you can't take red dye, what are you supposed to do? So that's a really simple example of how we can meet a need for a patient that may have a healthcare challenge that they don't know how to deal with. So don't be afraid to give us a call if you have challenges that are similar to that.
Why don't we have a brief discussion here before the show ends about topical preparations such as diclofenac, the local anesthetics sort of products that arrive, that come in roll-on creams, all that sort of a thing. Some of these products that have come in the marketplace are really excellent for, arthritis, joint pain, whatever. What's your take on that, Brad?
We have more treatment options over the counter today than we ever have. Lidocaine patches, you can buy a particular strength of those over the counter without a prescription. There are some topical creams, like you mentioned. The generic for Voltaren cream has gone over the counter. If those you've tried and maybe they don't take the edge off your arthritis in your knee or maybe the pain in your lower back, we can take it to the next level. With talking with your provider, we can help you get a prescription for a medication that has a combination of products. And sometimes what one of those products by themselves won't do, a combination can have like an effect that's better together than separately alone. So, we can customize a topical cream that has, an anti-inflammatory for pain. It can have a topical anesthetic to help give you some relief to some nerve pain. It can even have a muscle relaxant in it. So when you combine things that work in more than one method in a topical preparation, the good benefits you can have are you can have relief from your pain or your ache or your discomfort. You also don't have upset stomach because you're taking pills that upset your stomach, and it isn't going to impair your cognition if you need to drive or need to go to work. So the possibilities are endless. You just need to think about the problem you have and talk to us at the pharmacy and see if we can come up with a solution for you. So whether it be arthritis or neuropathy or some other type of discomfort, we may be able to customize a solution for you for something that'll be easier on your stomach and easier on your pocketbook.
In the Voltaren and diclofenac package is a measuring strip for how much ointment or cream you should apply. How important is that you stay within the guidelines of that? I know currently we have ointment bases and cream bases now that really help push medication through the skin dramatically compared to what we had years ago. So what's the deal with the measuring?
They're looking for a certain volume. We need to wrap it up, but I'll say in closing, the thing that we like to do, we like to put our prescription preparations in a meter dose pump. So you can do 1 pump or 2 pumps. You don't have to screw around with that measuring. If you don't apply enough medication, you just may not get the desired effect. So.
Okay. All right. How much time we got left? Are we done?
Yeah, we're done.
We're done. Okay. Thanks for listening this morning. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. And thanks to our sponsors, Genure Appraisals and Liquidations, Studio Arts and Glass. And as always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you again right here next Friday on News Talk 1480 WHBC.